Because there is increasing evidence, and the professor I work for came up with the idea to look at it more closely. He's on pancreatic surgery, and pancreatic cancer and diabetes is already a known risk factor, but then in pancreatic cancer, the cancer can cause the diabetes. So we were interested in whether in other cancers diabetes increase the risk as well, and then with the existing evidence that is already there, we wanted to look at it further. Yeah, obesity is a risk factor for different types of cancer, also the same cancers as diabetes is a risk factor for, but that is therefore really studies should adjust for BMI and even other factors, but indeed it is important to distinguish these two. Well, we pooled already performed studies. We performed a meta-analysis, so we put them together and we obtained an overall outcome. And we obtained the unadjusted hazard ratios for our overall outcome, which means that they were not corrected for BMI. The studies were varying from breast cancer incidence to colorectal cancer incidence to breast cancer mortality and colorectal cancer mortality, and really cancer-specific mortality. Both, but mainly type 2 diabetes. Yeah, there was a small percentage, which I can tell you what the exact percentage is, but mainly type 2 diabetes. We found that for breast cancer, there was a 23% increased risk among diabetics compared to non-diabetics. And for colorectal cancer, there was a 26% increased risk. For mortality, there was a 38% increased risk for breast cancer, for the mortality. And for colorectal cancer mortality, the risk was increased with 30%. Even for the future, it's worrisome because the forecasts of obesity are only rising, and because obesity is linked to diabetes, and diabetes is just possibly linked to cancer. We think people should be really aware of this association, and that people should aware that they prevent obesity and prevent diabetes, and that's really important. Well, we couldn't say that really roughly from our study, because as I told earlier, we did analyze adjusted hazard ratios and put them together, and then still the risk was increased, but the studies did not compare for the same thing, so it was a bit comparing apples and oranges, so it wasn't really a fair comparison. But still, then it was a significant risk, so that indicates that diabetes is an independent risk factor. Well, we think mainly for type 2 it's more important. There is more evidence that type 2 has more risks for cancer. And type 2 is, of course, you can treat it, you can prevent it. Type 1 diabetes, you cannot prevent it. So it's more like we really think type 2 diabetes should be prevented. We were not able to look at that because the included studies did not account for the use of diabetic medication. But it is known that metformin is protective. Well, it's said to be protective. And insulin, different types of insulin, are said to increase the risk even more. So yeah, that's really important. But yeah, we couldn't adjust for that. They should be aware that diabetics, which are an already more vulnerable population, even from a surgical perspective, because I'm from the surgical department, so yeah, diabetic patients are already more vulnerable. There are the increased risk of getting cancer, and increased risk of getting operated for those cancers. So I really think people should be aware, and eventually prevention campaigns, they should really make the normal population aware of the risk of diabetes and cancer, because now it's already known among researchers and among doctors. But I really think the average population should also know about this risk.